This is coverage of the World Healthcare Congress in Washington, D.C. I'm Mabel Jong, and we're back with Angela Mitchell of Intel. And it's so great to be able to check in with you, Angela. We got to speak with you about the Health Value Awards recently. And now we're just going to talk generally about how employers are really taking a big role in trying to transform the system of healthcare as we know it today. What is specifically working at Intel that you can share with other people here at the Congress?
So yeah, happy to share. Intel about 5 years ago launched our first accountable care organization, or employer-led ACO. What that means is we went in locally to a healthcare system provider company and said, you know, if you're willing to think differently and are interested in trying to do something innovative in partnership with Intel, we're looking to improve healthcare for our employees and families. So we now have 6 of those ACOs up and running in the country. It's been a busy 5 years of launching them all. They're all in our major markets, and the provider groups that we're partnering with really have created good outcomes in terms of improvements to population health and experience. We ask that healthcare is made easier because we heard from our employees and families that it was pretty complicated and complex, and lots of having to call various people to get one of the things that they needed answered. So we really have a concierge approach with a dedicated team. So when you answer the phone, there's actually a human there, all the way to a highly integrated, coordinated network of providers that are high quality, high performing. So from when you need the care and you are in those doors, you're getting really high quality outcomes in care.
What an opportunity for the provider partner to get get a call from Intel and to partner in this and to find systems that work better for their employees.
That's what we're hearing.
Well, what were they doing that was attractive to Intel to have you choose them?
They met various standards of quality. So my background's in healthcare, and I was very much focused on patient-centered medical home models, and we really feel that that team-based approach to care is very important. So it's really the fundamental part of our model that makes it work. So all of the healthcare system partners had that type of model in primary care, and then beyond that is the medical neighborhood in connection to doctors and specialists that are in the hospitals and various facilities. So having an integrated approach was important to us. They all very much carried that, but then also the willingness to think differently about traditional models and be disruptive in healthcare. They all carried that as well. That's critical. Without that partnership and that trust that we've built with these healthcare systems, and without them being willing to take risk in these contracts, which is an upside downside risk involved, we wouldn't be successful in sitting here today talking about the great outcomes. So we chose the ones that were really willing to partner and to be innovative, but really felt that they were going to be able to deliver on that triple aim outcome. So.
Now, in terms of these partners, how are they making employees' lives easier? Because your employees were saying it's kind of difficult in what they had to deal with now. So you went
couple
and
different
that.
things. Yeah. So you know, a couple things that come to mind. I should say there's several. The concierge approach, like I talked about, having an actual person answer the phone that's an expert not only at the benefits provided to employees and families, but also the care delivery experience. So connecting the dots back over into the healthcare system for patients instead of expecting patients to do it themselves is key. And then having a dedicated care delivery team. All of our models have that approach. So if you have really high needs, you're going to have the same nurse case manager who's going to be picking up the phone or emailing you or meeting with you when you're going to see your primary care doctor at your medical home. She'll actually come sit in the room with you, or he will. So having that dedicated concierge on the care delivery side as well as the plan side is key, and having them be integrated together so they're doing work for the patients instead of the patients being expected to do it. I think another key is we knew that healthcare doesn't always have to be a sit-down visit with a doctor. And our employees are busy, and they are always constantly trying to do the next thing, and they have families and a lot of stuff going on. So knowing that alternative venues of care would be attractive to them, we ask all of our ACO partners to think about ways to implement technology to drive better utilization into alternative venues. So video visits, telehealth solutions, is something that we're seeing has been very widely adopted across our ACO populations. And as everybody knows, it's a cheaper experience, right? It's not going to cost you as much out of your pocketbook, and it's also a really convenient experience. And, you know, picking up the phone or doing the video visit, especially if you have a bunch of kids at home, you don't have to load them all up to go into the doctor's office. Now you can just do it in a matter of minutes and have the prescription picked up down the street. So those are a couple that come to mind. There's a lot of other elements to the contract in these ACOs where we ask for improvements, and they're responding really well. And I think the win-win-win situation that I call it is when they already had a lot of these items for improving their models on the roadmap, but now that a purchaser and a provider are at the table together, we're seeing a lot of those improvements happen quicker in the healthcare delivery systems, and they're really enjoying it because they get to say, hey, our partner Intel really wants us to improve here, and then all of a sudden the resources and the momentum happens as a result.
So are you finding that even though they designed this for Intel, that it's carrying over to their other organizations that they're working with? Yes,
exactly. So that's another huge piece of the success that these ACOs have brought to the table for these providers. Again, it's a great win for them because they're leveraging our relationship, obviously the purchasing perspective, but also we're asking for the things that they really know are going to make improvements across the board, and that is what we're hearing from them. And that's our intention behind what we're doing in healthcare, is not just to improve it for Intel's population, but really the broader community as a whole.
Powerful. How are you finding the conference so far? I
think it's been great. It's been a lot more interest, I think, in the role that employers play as a purchaser in healthcare. And it's been fun to share what we've done at Intel and really encourage other employers to start thinking differently about ways to disrupt these traditional models and to start doing something to improve their own healthcare for their populations.
All right, Angela Mitchell, thank you so much for your time.
All right, thank you.
And thanks for staying with us. Tune in for more interviews to come.